Leukemia is cancer of the white blood cells. Acute leukemia means that it progresses quickly and aggressively, and it usually requires immediate treatment. Acute leukemia is classified according to the type of white blood cell affected. The two main types of white blood cell are the lymphocytes, which fight viral infections, and the myeloid cells, which do different things, such as fighting bacterial infection, defending the body against parasites, and preventing the spread of tissue damage. Researchers suggest low vitamin D levels mediated by low ultraviolet B exposure may be responsible for many leukemia cases worldwide. You can get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to correct any deficiency. Vitamin C reduces the risk of leukemia, and it may also be useful as chemotherapy for blood cancer. This is according to two recent studies. Both studies examined how vitamin C affects the metabolism and the genetics of blood forming, or the hemopoietic stem cells. Mutations in these cells give rise to various forms of blood cancer. A recent study found that human and mouse hemopoietic stem cells absorb unusually large amounts of vitamin C. When the cells were depleted of vitamin C, they were more likely to turn into leukemia cells. The results indicate the importance of taking 100% of the recommended amount of ascorbate or vitamin C, especially for older people. Another study found that high doses of vitamin C can cause leukemic cells to die, potentially making it a useful and safe chemotherapeutic agent. The study was led by scientists at NYU Langone Health, and it was published in August 2017. For this purpose, an IV vitamin C drip would be recommended, or the best oral form would be liposomal vitamin C at a minimal dose of 10 grams per day. Since cellular antioxidant capacity is decreased in leukemia, the administration of antioxidants like curcumin is highly beneficial. Curcumin promotes apoptosis in several cancer cell lines, and it enhances the anti-cancer effects of chemotherapy. Typical doses of curcumin range from 1 to 5 grams per day, but due to curcumin's low bioavailability, its absorption should be enhanced with biopterin, which is a black pepper extract, or taken with a fat such as coconut oil, butter, ghee, or fish oil. A new study shows that leukemia actively undercuts the ability of normal cells to consume glucose, thus leaving more glucose available to feed its own growth. Cancer needs energy to drive its out-of-control cell growth. In order to help to starve the cancer and allow other therapies the time to work, a sugar-free diet, like a ketogenic diet, has been shown to be beneficial and temporarily stop the progression of many cancers due to their reliance on the sugar. Several small clinical studies have found that coenzyme Q10, ubiquinol supplementation, may have potential benefits in different cancer types like breast cancer, leukemia, lymphoma, melanoma, and liver cancer, by either reducing the levels of the inflammatory cytokine markers in the blood, improving the quality of life, reducing the treatment side effects such as the cardiotoxicity, reducing the recurrence, or improving the survival. Hence, taking coenzyme Q10 rich foods may be possibly beneficial for these cancer patients. The best form would be ubiquinol, with typical doses ranging from 100 up to 400 milligrams per day. Resveratrol is found in small amounts in red wine. Preliminary results suggest that resveratrol also inhibits the viability of freshly isolated leukemia cells, especially pro-myelolytic leukemia cells, because of its low in vivo toxicity. Resveratrol deserves further investigation as an anti-leukemia agent. Typical standard doses of resveratrol are 500 to 1000 milligrams per day in the form of trans resveratrol. Quercetin caused pronounced apoptosis in P39 leukemia cells, followed by BCL2, BCL-XL, and MCL1 downregulation. Bax upregulation and mitochondrial translocation, triggering cytochrome C release and capsase activation. Quercetin also induced the expression of the FASL protein. Typical doses of quercetin are 500 to 1000 milligrams per day. Quercetin also enhances the absorption and the action of vitamin C, shikimic acid, and zinc. Low blood levels of zinc are often noted in acute lymphocytic leukemia, therefore zinc supplementation may also have benefits. Vitamin B12 deficiency can cause extensive hematologic alterations such as pancytopenia, macrocytosis, hypersegmentation of neutrophils, and hypercellular bone marrow with blastic differentiation. These dysplastic changes can sometimes be so profound that they can mimic myelodysplastic syndromes or even leukemia. A blood test for B12 can fail to detect a deficiency due to food now being fortified with folate, and folate's ability to give a false reading on a B12 blood test. If you're unable to get B12 injections, the next best form would be a sublingual methylcobalamin B12 supplement taken at a dose of 5,000 micrograms per day. Scientists have discovered that acute myeloid leukemia grows by taking advantage of the B6 vitamin to accelerate cell division. The research team from Cold Spring Harbor Laboratory and Memorial Sloan Kettering Cancer Center suggest that they could halt the growth of this cancer by limiting its ability to manipulate the enzyme that pushes vitamin B6 to make proteins that are essential for cell division. It's an approach to attacking cancer without harming healthy cells, which need the vitamin B6 to survive. The body naturally kills cancer cells on its own. This process is called apoptosis. This occurs when proteins, specifically capsases, break down cellular components and they activate enzymes that destroy a cell's DNA, making the cell effectively commit suicide. A healthy cell will go through this process and die after roughly 120 days. But for cancer patients, apoptosis can be triggered to kill off unhealthy cells on demand. Researchers are excited about the anti-cancer properties of ellagic acid. It's found naturally in lots of healthy foods like grapes, raspberries, strawberries, and walnuts, and new research highlights its apoptosis-inducing abilities. Scientists in Seoul, South Korea, found that ellagic acid slows the growth of cancer cells, and it jumpstarts apoptosis when it's applied in high doses. But even in smaller doses, it can start apoptosis within the body. Adjone, a garlic-derived compound, has recently been shown to inhibit the proliferation and to induce apoptosis of human leukemia cells and to induce apoptosis in myeloblasts. There's a high prevalence of chronic magnesium deficiency in T-cell lymphoblastic leukemia. Most individuals are deficient in magnesium. As magnesium is required by over 300 enzymatic processes in the body, supplementing with it can have many profound benefits after a few months of use. Start to slowly increase your dose of magnesium, taken in the form of magnesium bisglycinate, until side effects like stomach discomfort or diarrhea are noticed. Then reduce the dose until you're able to determine your maximum tolerable daily amount. Cat's claw, the herb's oxandole alkaloids, notably Uncurin F, are also active against several lines of leukemia. Cat's claw does appear to be effective in treating feline leukemia virus, and case reports on the effectiveness of cat's claw given to Peruvian children with leukemia are also promising. Iodine deficiency can play an important role in leukemia. Certain roles of iodine in well-being and protecting against infections, degenerative diseases and cancer may not involve its action on specific organs and tissues. Instead, such properties affecting every cell in the human body may depend on the iodine to iodide concentration in biological fluids. The most non-toxic bioidentical form of iodine is called nascent iodine. Pycnogenol, which is pine bark extract, induced the differentiation and the apoptosis in leukemia cells, so the data suggests that the pycnogenol could serve as a potent cancer, chemopreventive and chemotherapeutic agent for human leukemia. Immune dysregulation is a hallmark of chronic lymphocytic leukemia, and it manifests itself in 3 autoimmune diseases: warm autoimmune hemolytic anemia, idiopathic thrombocytopenia, and pure red cell aplasia. Check out my videos on natural ways to help to treat autoimmune diseases for more information about these type of conditions. The human stress hormone cortisol has been identified by scientists at the University of Kent as a key factor when the immune system fails to prevent leukemia from taking hold. The herb holy basil, known as tulsi, or the supplement phosphatidylserine, dosed at 600 to 800 milligrams per day, have been shown to help to control cortisol. Household insecticide may increase the risk of childhood leukemia. This was suggested by French research in occupation and environmental medicine. Electric blankets have been linked to childhood leukemia and miscarriages because of the fact that electromagnetic fields created by them are able to penetrate up to 7 inches into the body. People who are exposed to fluorescent light at home or in the workplace can experience feelings of reduced alertness, which in turn can lead to feelings of being more tired than usual. This is because the electromagnetic fields which are emitted from these lights cause red blood cells to clump together. Clock radios, which are electric, emit relatively high electromagnetic fields, so these should ideally not be placed at or near your bedside. Other electrical items which emit low levels of electromagnetic fields, like hairdryers, washing machines, refrigerators, electric shavers, and vacuum cleaners. Basically anything requiring electricity to work will emit low levels of electromagnetic fields around it. Soy has been linked to a myriad of health conditions such as infantile leukemia, various forms of cancer, type 1 diabetes, malnutrition, thyroid dysfunction, and even erectile dysfunction. Research has shown that babies who've been fed soy-based formulas were at a higher risk for developing type 1 diabetes and thyroid disease later in life. Soy-based formulas also contain up to 1,000 times more aluminium than non-soy-based formulas. Soy contains a large amount of anti-nutrients, otherwise known as toxins. One of these is what is referred to as an enzyme inhibitor. Enzyme inhibitors block the action of the enzymes which are required to digest protein. Even cooking the soy at high temperatures doesn't break down these inhibitors. As a result, consuming soy and soy products can lead to conditions such as reduced protein digestion, excessive bloating, a deficiency of essential amino acids, abnormal thyroid function, a higher risk of breast cancer in women who've had their ovaries removed, and abnormal blood clotting. Mineral deficiencies of calcium, magnesium, copper, and zinc have also been reported from soy consumption. Stimulating molecules overactivate the immune system and they cause it to collapse. And we are, of course, interested in blocking this mechanism. It's now been shown that certain selenium compounds, which are naturally found in foods like garlic and broccoli, effectively block the special immunostimulatory molecule that plays a serious role for aggressive cancers like melanoma, prostate cancer, and certain types of leukemia. The recommended daily dose of selenium is 200 micrograms per day. You can get this selenium requirement with a supplement or by taking 3 Brazil nuts per day. Every 5 kilograms per meter squared increase in your body mass index has been clearly linked with higher risk of cancers of the uterus, the gallbladder, the kidney, the cervix, the thyroid, and also leukemia. The higher BMI also increased the overall risk of liver, colon, ovarian, and breast cancer. The carrot has also been found to have a good effect on leukemia. Carrots contain beneficial agents called beta-carotene and polyacethylenes, and these could be effective in the treatment against leukemia. Ginseng is a well-known herb often used in combination with anti-cancer drugs to enhance the chemotherapy. Its wide use, as well as many documented effects, are often cited to support its clinical benefit of such combination therapy. Astaxanthin, one of the most powerful antioxidants available. A daily dose of 12 milligrams would require you to eat a full wild salmon in order to obtain it naturally. It's 6,000 times stronger as an antioxidant than vitamin C. Astaxanthin has demonstrated a consistent ability to reduce multiple types of cancer. For more information about the herbs or supplements mentioned in this presentation, check out my website.